Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Good morning, everyone, and welcome to the Executive Innovation Show's Knowledge Knugget, brought to you by One Touch Telehealth. Today, we're going to be talking about how does telemedicine improve the quality of care. As we look at post-COVID, pre-COVID, middle of COVID, whatever you want to call it, I think telehealth and telemedicine, improving the quality of care, has shed a ton of light on access to care for folks that live in rural demographics and maybe even in FQHCs and population health that may have not had access to care previously, given the rise in telemedicine and given the rise and trying to keep patients safe. This really allowed, with Medicare and Medicaid, unlocking codes and making it more accessible for patients to stay at home. This really improved the quality of care and the access to care. So if we talk about the access to care, normally the wait times to see a provider, the having to see specialty providers during COVID, specialty providers went 80 to 90% telemedicine. And this really provided a lot of access for new patients, as well as caring for existing patients and vulnerable patients. As we look at the quality of care for high-risk patients that have chronic care conditions, whether that's cardiology, nephrology, pulmonology, wherever that may be, keeping those patients, especially we saw a lot of it in oncology as well, being able to allow patients to stay at home, seeing patients in dialysis centers, seeing patients in cancer centers, and checking in more with them. So when you looked at the providers that would usually see these patients maybe once a month, once a quarter, providers were really reaching out more proactively. Offices were reaching out more proactively to make sure that patient population that did have chronic care conditions that were highly vulnerable to COVID, that they were okay, and that they were doing more appointments, because telemedicine typically on average is 4 to 7 minutes versus in person, which is significantly higher. The average patient spends 2 hours and 15 minutes going to a patient appointment and spends 5 minutes with the provider. So being able to spend more time, freeing up providers' time, instead of going room to room, or they are now not going on the clinical rotations, not going to hospitals, dialysis centers, keeping themselves safe. So overall, the industry saw an improved quality of care. And then lastly, when you look at a lot of populations that use the ER as their primary care, for population health, for Medicaid type patients, that typically, there's very long times of getting into a primary care provider. When that wasn't an option, being able to start to establish a relationship with a primary care provider, or establish a relationship and more proactively use telehealth, improve that quality of care, as well as reduce the healthcare cost. So that's for today's Knowledge Nugget of how does telemedicine improve the quality of care. I think we've seen it on many fronts, and I think this is just paving the way for the improvement in quality of care that we're going to see across the industry post-COVID, as people are now, both the patients, providers, and administrators, have seen the benefits of telemedicine, both on improving the quality of care for the patients and improving the quality of work-life balance for providers. And so I think we're going to see much more of that. Stay tuned, subscribe to get your weekly knowledge nuggets and podcasts on your podcast player of choice, and we'll see you next week.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.